Hello everyone, I'm Dr. Jennifer Chen and welcome to my channel. Today we're going to talk about how to impress your attending. First, allow me to introduce myself. I was a faculty member at UTESCA, University of Texas Health Science Center, San Antonio. Also, I was a clinical faculty at PNWU Health Science, Pacific Northwest University Health Science. Since 2012, I was a team member, then eventually a team lead in the CMDA MEI team for medical education. So I had a lot of experience in training medical students, residents, fellows, and even faculties. So now let's go back to today's topic, how to impress your attending. I know this idea has been on the back of your mind for a while now. You really want to impress your attending for various reasons. You want to get a good evaluation, you want to have a good relationship, you want to learn more from your attending. But most of the students, fellows, or candidates, when I talk to them, they think it's mission impossible, like you can never impress your attending. So hopefully today I can share with you some of the secrets, so next time when you're on a clinical rotation, you will be more confident and you will know that you can impress your attending. In our last video, we talked about why most LORs, letters of recommendation, won't count. Because they're not considered as outstanding LORs to change the program director's mind. But what are the reasons that most candidates are not getting outstanding LORs? The first reason is if there is a lack of evaluation mechanism. So if the attending you're following or the clinic or the hospital you're going to, they just had no intention to evaluate you in the end, they won't observe the details or they won't try to find things to evaluate, and in the end they probably will say, sorry, I just don't feel comfortable giving you a recommendation letter. The second reason is the evaluators, they simply just don't have enough teaching experience. They can be excellent clinicians, they can treat their patients really well, but regarding to the teaching, they just simply don't know what to look for and how to evaluate people. So for the first two reasons, as a trainee, there's not much we can do to change it. But the third part is how the video is really going to help you. It's to help you to make a distinct impression on the attending. So after your training is done with the attending will actually remember you. Okay, so before I spill out the secret, let me divert a little bit and we're going to talk about mini CEX. Mini consultation evaluation exercise. I believe this evaluation is going to be used for certain pathways when you apply for ECFMG certificate too. So what is the mini CEX? It is a direct observation of interactions between the trainee and a patient. It's supposed to be a snapshot, and you can actually find any clinician, any doctors you like to be the assessor, to give you an evaluation. And it's carried out throughout the whole training. It's not used as a final exam or a summative exam. It usually lasts about 10 to 20 minutes. The trainee's performance will be rated. Your assessor, your evaluator, will give you a verbal feedback. Then they will also write down their written feedback on the form as well. So what are the skills or areas of being evaluated? There's a small difference between schools and programs, but they usually include these areas. Your medical interview skills, physical exam skills, communication and consultation skills, clinical assessment and judgment, clinical management, professionalism, and then the organization efficiency. With each of the evaluation not all the areas will be assessed. So usually only 1 to 2 areas will be assessed. The reason it is so hard for the trainee to perform really good on the mini CEX is usually because of the time strain. Everybody's so busy and the attendings can be impatient sometimes, and they sometimes will tell you to just cut to the point. So it's really important to show what you know and what you're thinking with the time you get. So hopefully in the next few minutes I'll be able to teach you how to really do that, how to really show them what you know. So now let's talk about SNAPPS presentation methods. It's a 6 steps learner-centered approach. The SNAPPS, they each stand for one action. So S is for summarize, N is for narrow, A is for analyze, P for probe, P for plan, and S for select. Very confusing, right? No worries, I will clarify things for you and teach you what to do exactly. The first step is to summarize briefly your history and physical exam findings. It should be less than 3 minutes, so be very brief and cut to the point. Let me give you an example. So you should present like this. Elijah is a 7-year-old male with a 3-month history of right knee pain and swelling that occurs daily. No other joints are affected. He reports difficulty playing soccer. He denies current or previous illnesses, no recent travel or injury. Daily ibuprofen provides little benefit. So very brief and summarize everything. Then the second step is narrow. Now you're supposed to provide 2 to 3 possibilities of what the diagnosis could be. And you should not wait for the preceptor to ask you, so what's your differential? No. Present your list before he asks you, before he has a chance to revise the list. So for example, what you can say is, given the length of the symptoms, my differential diagnosis includes juvenile idiopathic arthritis, reactive arthritis, and injury. Then the third step is analyze. You discuss the possibilities and analyze why the patient's presentation supports or refutes the differential diagnosis. It's very important to think out loud in front of the preceptor so he knows what you're thinking. So the example will be, I think juvenile idiopathic arthritis is highest on my differential diagnosis. Given the age of the patient and the length of the symptoms, reactive arthritis is lower on the list due to the length of symptoms and no history of previous illness. Injury is low on the differential due to no history of injury. Now, in like less than 3 minutes total, the attending already knows what you're thinking, what's your differential, and what are your reasons. The fourth step is to probe the preceptor. It's to discuss areas of confusion and ask questions of the preceptor. Allow the preceptor to learn about your thinking and knowledge base. And it will prompt discussion from the preceptors on clinical pearls or areas of importance. So for example, what you can do is you can simply say, is there anything else that I should include on the differential? So the preceptor may discuss the importance of considering septic arthritis in the differential diagnosis. The fifth step is plan. Is to discuss a management plan for the patient or outline next steps. Make sure you commit to your plan and utilize the preceptor as a source of knowledge. So it's important for you to say, I want to do this, rather than asking permission from the preceptor to do something. For example, you can say, I would begin a prescription strength anti-inflammatory medication and order an ANA. Now the last step, the sixth step, is select. Select a self-study topic. You can identify a learning issue related to the patient encounter, or you can discuss the findings from the learning issues with the preceptor. It can be a very simple issue, like I want to know more about this medication. I will learn about its side effects and indications. For example, you can say, I would like to understand the relationship of the ANA and the need for ophthalmology monitoring in juvenile idiopathic arthritis. I think at this point your attending will be super impressed, because for me, I never thought about these self-study topics. So when you use the whole SNAPPS approach, you are demonstrating to your attending your medical interview skills, how you gather your information, your physical exam skills, not directly, but you are telling him what you found on your physical exam. And you are showing you can definitely communicate well with him. And also you have your own clinical assessment and judgment skill. You also showed him how you manage the patient. And you are very organized and you're very efficient. And overall, you're handling the whole patient encounter in a professional way. So what you can see is, from using the SNAPPS method, you should be able to impress your attendings pretty easily. As a matter of fact, for any medical students or resident or fellows, when they first start with me, I'll give them a handout for how to do the SNAPPS method. And I actually tell them, if you want to learn more from me, you want me to give you a good, thorough evaluation, or if you want to impress me, just use the SNAPPS, and we're on good grounds. And that's all for today's video. I hope the content for today's video is helpful for you. And if you like the video, please do subscribe, like, share, and comment. Thank you. And you all have a great day. See you next time.